Welcome, beloved students. We are going to start a next chapter in general pathology and pathology. This course is designed from many books like Robbin Pathology, Pathoma, and all the standard books all over the world. Let's start inflammation. Inflammation is a process which is both protective and damaging. Inflammation is a process both protective and damaging. How inflammation is protective? Like in infection, inflammation is protective. But how it is damaging? Like in autoimmune diseases, inflammation is damaging. So, if examiner asks, is inflammation a protective process? Yes. Is inflammation a damaging process? Yes. So, if an examiner asks whether inflammation is acute or chronic, inflammation can be acute, can be chronic. Acute means for a shorter duration of time, from minutes to hours, while a chronic inflammation means for longer time, means for days. Which cell is dominant in inflammation, in acute inflammation? Neutrophil is dominant in acute inflammation, while macrophage or lymphocytes are dominant in chronic inflammation. In acute, there are more clinical symptoms, while in chronic, there are milder symptoms. So, if an examiner asks, is inflammation a protective process or damaging process? Your answer will be, it is both protective and damaging process. Inflammation is acute or chronic? Inflammation is both acute or chronic. This is very important question. Which cell is dominant in acute inflammation? Neutrophil is dominant in acute inflammation. Which cell is dominant in chronic inflammation? Your answer would definitely be macrophage or lymphocyte. Okay, let's first, in this first lecture we will discuss acute inflammation. This was just an introduction. Now we will start with acute inflammation. So acute inflammation is divided into two events. Vascular events means going inside the vessels, and second are cellular events. Let's first discuss the vascular events. For example, this is a blood vessel. This is what? This is blood vessel. Blood vessel is lined by which kind of a cell? Endothelium. Endothelium. In acute inflammation, first we are going to discuss vascular event. For example, this is a blood vessel. It is lined by endothelium. There is an injury or stimuli. There is an injury or stimuli. There is an injury or stimuli to what? To this blood vessel. Remember, the first response or the earliest response to this injury or stimuli by the blood vessel is vasoconstriction, and it is for very short duration of time. Therefore, I have already mentioned it is transient. So remember, it is an MCQ question. In vascular events, in acute inflammation, in vascular events, the earliest response produced or generated by the blood vessel to the injury or stimuli is vasoconstriction. Whether it is for short duration of time or long duration of time, it is for shorter duration of time. The second event is vasodilation. The second event is vasodilation. For example, these are endothelial cells. For example, these are endothelium cells. Endothelial cells. So you can see when there is a vasodilation of this blood vessel, there is increasing gap between the endothelial cell. So the permeability between these two cells is increased. First is vasoconstriction, then the vessel dilates. When the vessel dilates, the gap between two endothelial cells is increased. So there is increase in the permeability. So the third event is increase in the vascular permeability. And when an examiner asks which is the hallmark of acute inflammation, your answer would be increased vascular permeability, increased vascular permeability. So when the vascular permeability is increased, vascular permeability is increased, there is accumulation of the cells. Accumulation of what? Accumulation of the cells mean the cells are now concentrated. When the cells are concentrated, it means viscosity is increased. Viscosity is what? Viscosity is increased. And now in this cell neutrophil is present. In this cell neutrophil is present. In anywhere in the body, when neutrophil will find any kind of foreign body or material, this neutrophil will go outward, and this process is called stasis. Because initially these cells were moving faster because of the dilution. Now there is concentration. Due to this concentration, the movement becomes slower. Now neutrophil can easily stasis out from this blood vessels. So four events are present in vascular events. Four steps are present, or four events are present in the vascular event. First is vasoconstriction, then vasodilation, then increase in permeability, then viscosity in increase, and stasis is developed, and neutrophil easily goes outward. Why I am not saying macrophage or lymphocyte? Because this is acute inflammation. This is acute inflammation. Now we will discuss a little bit about vascular permeability. So vascular permeability mechanism. How vascular permeability is increased? By endothelial gap formation. Sorry. By endothelial gap formation, as we have discussed, this endothelial gap formation take place at the level of venules. This endothelial gap formation take place at the level of venules. But when an examiner asks, there is an area present in the body where endothelial gap formation take place in the capillaries. So your answer would be in the lungs. In the lungs, endothelial gap formation occurs in capillaries, while rest of the body endothelial gap formation take place in venules, not veins, venules. And this process is immediate and transient response. This is immediate and transient response. Second process by which vascular permeability is increased is endothelial damage. Endothelial damage are of many types. The first one is direct endothelial damage. In direct endothelial damage, their vascular permeability is increased. And in direct endothelial damage, this is a process which will be immediate prolonged response. Immediate prolonged response. Now the next one is mild endothelial damage. You can see in the sunburns, not subburns, I have corrected sunburns, there is vascular permeability also increased. And in mild endothelial damage, this process is delayed and prolonged. The third one is leukocyte mediated damage, and this one is delayed and prolonged response. So this was about vascular events. Now let's move toward the cellular events, and the cellular events are very important. First of all, understand the neutrophil. This is neutrophil. Two molecules are present on the neutrophil. One is called integrin and one is called silyl-Lewis ligand. Silyl-Lewis ligand and integrin. It having higher affinity and this having a lower affinity. Got it? Now let's begin cellular event. Now this is a neutrophil. This is a complete blood vessel, and how will it goes outside the blood vessel towards the foreign body. This is neutrophil. First of all, margination happens. Margination means the transient attachment, the short-term attachment of the neutrophil to the endothelium. Short-term attachment of the neutrophil to endothelium through silyl Lewis ligand plus E-selectin. For example, this is a neutrophil. Neutrophil hence silyl Lewis ligand. Got it? Silyl Lewis ligand and endothelial selectin is present here on the endothelium. Silyl Lewis ligand combined with this endothelium selectin, E-selectin. This is called margination. Now the second step is called rolling. Rolling means now the neutrophil attaches to this endothelium, but here silyl Lewis ligand uses P-selectin instead of E-selectin. And here is a transient attachment and detachment of the neutrophil. The neutrophils attach and then detach, attach and detach, attach and detach. This is called what? This is called rolling. The third step is called adhesion. The third step is called adhesion. It is a strong attachment of the neutrophil to the endothelium through intracellular adhesion molecule, or vascular cellular adhesion molecule. And here the affinity is higher, increased higher affinity. So first step is margination, transient attachment and detachment of the neutrophil to the endothelium, and then rolling, attachment and detachment, then adhesion by using ICAM or VCAM. Got this point? Here the cell will also use silyl Lewis ligand. The fourth step is pavimenting. What? Pavimenting. Pavimenting means the overlying of the neutrophil on the endothelial lining. This is, for example, endothelium, and these are neutrophils, and these overlines on this endothelium. It is called pavimenting. It is called what? Pavimenting. So you can remember easily this fourth step by this mnemonic, Michael Jackson rap song. M for margination, rolling, adhesion, and pavimenting. The fifth step is diapedesis. Diapedesis means in the lungs at capillary, and in the rest of the body in venules. Diapedesis means migration of leukocyte. Leukocyte means neutrophil. Transmigration of neutrophil through endothelial gap. And here the most important adhesion molecule in this step is platelet endothelial cellular adhesion molecule, or which is also called CD31. And then chemotaxis happen. Unidirectional movement towards the chemotactic stimuli means the neutrophil comes out and going towards the stimuli, going towards foreign body. Got it? So these are the system. Neutrophil come here, it attaches a silyl Lewis ligand with E-selectin, it's called migration. Then attachment and detachment is called rolling. Then the strong attachment is called adhesion. Then the overlying on this endothelium is called pavimenting. Then endothelial gap formation take place, and here attachment through PKM is called diapedesis, and then going towards stimuli is called chemotaxis. But remember, beloved students, the chemotactic stimuli may be endogenous or exogenous. Exogenous means by maybe from foreign body like microbial antigen, and endogenous means the complements, the molecules of the body, like C5a, C3a, C4a, or it can be arachidonic acid metabolites in the endogenous. Arachidonic acid metabolite means the LOX or COX. LOX pathway leads to leukotriene B4 and COX leads to prostaglandins. And then the next step after chemotaxis is phagocytosis. It is a long process, so we will discuss in the next lecture. If you note notes in the PDF form, contact me. I have mentioned my contact number in the description or first comment. Try to watch other lectures if you like this kind of lecture. Thank you. Have a blessing day.